In this video, I'll uncover the signs and symptoms associated with a vitamin D deficiency. Now, most people are familiar with vitamin D and all the benefits that it has to offer your body. But what most people aren't familiar with is the fact that many are actually deficient in vitamin D. Most people aren't getting the proper blood tests to determine if you have vitamin D deficiency, and a lot of people have no clue what the signs and symptoms are. So that's why I'm here to help you with this today. We're going to talk about the 6 signs and symptoms of a vitamin D deficiency. This is something that is incredibly easy to work on, incredibly easy to utilize in order to boost your health in a drastic way. So stick around to the end of this video. But before we get started, I'm Dr. Zyrowski and welcome to the channel. If you're new to the channel, it's a pleasure to have you here. Be sure to subscribe, hit the notification bell, and join our notification community. That way I can help you excel your health and your life. Let's go ahead and talk about this vitamin D, which is so important. Okay, I want to talk about a few basic concepts of vitamin D first before we jump into the signs and symptoms. First of all, vitamin D is referred to as a vitamin, but it acts as a hormone in the body. Every cell in the body has a vitamin D receptors there, okay? Whether it's the nervous system tissue or any other cells in the body, they all have vitamin D receptors, so you can see how incredibly important vitamin D is for your overall health, and how if you actually have problems, you have a deficiency in vitamin D, your whole health suffers. Now, the vitamin D is made from cholesterol when exposed to sunlight, okay? We're going to talk about in a minute how important the sunlight is, and so that's one of the ways that you're going to get vitamin D. It's estimated that 1 billion people worldwide have a deficiency in vitamin D. Furthermore, they did a study in 2011. Here's what they found. Within America, 41.6% of people had a vitamin D deficiency. Based on your ethnicity, this number went up. If you were Hispanic American, the number went up. If you were African American, the number went up even further, because the darker the pigmentation in your skin, essentially the bigger problems that you have with vitamin D. And so we have to take that into consideration. Let's talk about some of the risk factors that are associated with having low vitamin D levels in the body. So that way you can kind of put all the pieces to this puzzle together and understand if this is an issue for you. So being elderly is one of them. They're associated with having low vitamin D levels. Dark skin, which I just talked about. Obesity is also a risk factor. Not eating fish and dairy. So if you're someone who doesn't eat fish or dairy, then this is likely a problem for you. Now, there's a very good likelihood that you are not going to get sufficient amount of vitamin D from eating fish and dairy, but it is some different food sources that has that vitamin D in it. When we look at many of these different countries out there where they live in cloud-covered regions and it's cold all the time, but yet they have sufficient amounts of vitamin D within the population there, it's essentially because they're eating so much fish. And so fish and dairy are 2 different food sources you can get it from. Living in a cloud-covered region is another risk factor. That is a huge risk factor, which I am actually having an issue with because I live in a cloud-covered region. I mean, we'll go 30, 40 days without seeing sunlight here sometimes, and though it's not real pleasant, it's just the way it is. And so if you live in an area of the country or you live in an area of the world where you're getting a lot of cloud cover, then there's a good chance that you have a vitamin D deficiency. Next thing is if you're getting less than 30 minutes of sunlight hitting your skin a day. I can't remember the last time I had 30 minutes of sunlight hitting my skin, to be honest. So for a lot of people, it's because they're working desk jobs, they're working inside all day, they're not spending any time outside at all. And that's one of the reasons they're not getting 30 minutes a day. And like I said, for areas where you live in cloud-covered regions, that would be a reason you're not getting 30 minutes of sunlight hitting your skin a day. But as a rule of thumb, that's what you want to get in order to have sufficient levels of vitamin D. And then of course, wearing sunscreen. This is a major issue. People have been scared out of their mind that they're going to get skin cancer if the sun, is on their skin for more than 5 minutes. And so everybody puts on sunscreen like it's going out of style. And as a result, they suffer and get vitamin D deficiencies. It's actually considered to be a huge reason as to why so many people have vitamin D deficiencies. Now, what I'll do too is I'll put a link in the description below to the vitamin D that we use clinically. It's an active form of vitamin D. It has K2 in it, so it can be absorbed better. It also is a good quality form. We know that it does a very good job at actually bringing low levels of vitamin D up to sufficient levels. We've done testing in order to see that that's happening. It's in clinically relevant doses. It works very well. I'll put that in the description below. Next year, let's talk about the risk factors, because this is important. And this is, as we go through these, I think a lot of people are going to identify with them. So first year is depressed immune system, okay? So if you're someone who is getting sick all the time, your immune system is shot, then you may have a vitamin D deficiency. What this research shows is that if you have increased illness and infection all the time, and you're getting the cold and the flu and different respiratory disorders, there's a good chance that you have a vitamin D deficiency. Combine that with some of the other risk factors we just talked about, you'll probably know if this is you or not. Now, this is something that's very interesting because in the United States, guess what we have? We have a huge population of people with vitamin D deficiencies. You know what else we have? We have a huge population of people who are getting devastatingly sick from the flu. Now, we hear year over year, basically, that the flu is just taking down so many people. It's killing people. It's wiping people out for weeks. It's so dangerous. Well, guess what? You combine the fact that we have a huge vitamin D deficiency and you combine the fact that we have a huge flu problem. Guess what? Put those together, and if you actually just boosted vitamin D levels, you would protect yourself from the flu. Now, here's the other thing. The solution for the flu has been basically to go out and get flu shots, which when we talk about that, I'm not going to go there. That's going to take me way off track. But basically do this. Boost your vitamin D levels, and then your body can protect itself. That will boost your immune system. That will protect you from the flu. In many areas of the world where they've done significant research on this, they found that vitamin D works incredibly well and even better than a flu shot. So take that into consideration. Let's go ahead and talk about chronic pain. Now, if you're someone who's in chronic pain all the time, there's a good chance that you could have a vitamin D deficiency. I'll work with patients all the time. They have fibromyalgia. Guess what that means? They just are in chronic pain everywhere. And one of the things that happens is we often see this vitamin D being a problem. So vitamin D is present in the different nociceptors, so in the nerve tissue basically, that are related to pain. 71% of people with chronic pain were vitamin D deficient. These same 71% of people who were in chronic pain, they brought their vitamin D to sufficient levels, and guess what? The pain went away. It was really incredible when we looked at the study how powerful vitamin D was for chronic pain. It also reduced growing pains in children by 57%. This is really incredible. And this study is particularly interesting because we have all these kids who get growing pains, and it's just like, oh, it's just part of growing up. And the fact is that they found that it's been related to having a vitamin D deficiency. And when it reduced it by 57%, what was incredibly interesting about this is that it was one treatment. It was one dose of vitamin D. It's not like they went under some crazy vitamin D therapy for weeks. They literally gave them one dose, one treatment of vitamin D, and literally it reduced it by 57%. That's incredibly powerful. If you have kids that are getting growing pains, take this into consideration. Chronic fatigue is another major issue. When we look at people in general, right? I mean, they are just taking down caffeine like you've never seen, energy drinks. Chronic fatigue is a major, major issue with a lot of people today. Vitamin D is necessary for energy, and basically a lot of studies basically correlate a deficiency with vitamin D to chronic fatigue. So if you find yourself with no energy, look to this problem. Look to the problem being a vitamin D deficiency. And maybe if you correlate it with some of these other issues we're talking about, it'll be a home run for you to really determine that this is a problem for you. Now let's talk about depression. Now this is something that I think is really, really important because so many people have this issue. Vitamin D deficiency linked to low mood and depression. Study after study showing this and proving this. Vitamin D receptors are in the brain, and what they found is that when you have a lack of vitamin D, it can actually affect the different neurotransmitters in the brain. There's emerging research on this, and I think it's going to be quite promising when we just see these simple things that can actually incredibly improve your overall quality of life. It also is related to seasonal affective disorder, okay? This is something that a lot of people have where I live because they're not getting a sufficient amount of sunlight and they don't have sufficient amount of vitamin D. So seasonal affective disorder, it just basically means you're not getting any sunlight and therefore your vitamin D levels go low. As a result, you're depressed, you have a lot of anxiety, you don't feel well, you have all these different problems we're talking about. Increasing vitamin D scores improve the mood according to so many different studies. And let me tell you, this is something that really bothers me because a lot of people have this issue, and guess what? They go to the doctor and they get antidepressants. They don't test them for vitamin D. They don't even look into it. They don't consider it. They go, oh, well, you just need some antidepressants. This will fix things up in no time. Instead, we need to look at vitamin D being an issue here because that's very, very important. We always want to try to go the natural route with our healthcare so that we can actually work to reverse the problem versus cover it up and potentially even cause more issues. Now let's talk about bone pain, okay? So if you're getting a lot of deep aches and pains, vitamin D may be your issue. Vitamin D strengthens your bones. The other thing is that deficiencies in vitamin D are associated with a lot of back pain. They found that people who have deficiencies, they got them to a sufficient level, the back pain started to drop off, really awesome. And then you're twice as likely to experience pain in your joints and your bones if you are someone who has a vitamin D deficiency. Think of all the people who are walking around with joint pain and just aches and pains all over, and they just get this really deep bone pain as well. Vitamin D could be the problem. Take that into consideration. Let's talk about brain disorders because this is another one that really bothers me. Like I said before, when we were talking about anxiety and depression, some of those different seasonal disorders, we also have a lot of people who are getting brain disorders. Now, vitamin D deficiency has been associated with Alzheimer's, dementia, autism. Think of the kids out there. Autism, schizophrenia, brain inflammation. Vitamin D has actually been shown to play a part in actually shutting down inflammation in the nervous system. And so brain inflammation is another major one. Let me tell you, when brain inflammation hits, this is something where people start getting anxiety, they start getting depression, they start getting all kinds of crazy mood disorders. It's a big, big deal, and not enough people are talking about this. I have some videos on this I'll share with you in just a minute. And then decreased cognitive function as well. So if you're someone who just, your mind doesn't work, lots of brain fog, it could be vitamin D. Give this video a thumbs up. Put in the description below your different thoughts on this. Put in there some of the symptoms you may have had when you had a vitamin D deficiency, how you got tested for it, how you actually reversed it. Put that down there below. Share this with your friends because many people are experiencing that. And then check out this video as promised on how you can improve your brain health so you aren't suffering day to day like so many people are. Check that out. Utilize these different nutrients here because this is what is really necessary to detox the brain and offer the proper brain support.